does not love Beyonce? I thought we could start off with some Beyonce today. Good morning, everyone. It is morning here in Austin, Texas, Central Standard Time. I'm going to go ahead and hide this because I don't want to see anybody's face right now but mine. You're welcome to keep your camera off if you'd like. I am recording myself, and I do that to perfect my craft, and because I've worked in the digital space long enough to know that you don't do anything without recording, because you will probably need it at some point, at some time, but I am not recording any of you. Again, welcome to the presentation today. I just realized before I started that I had the chat to where only participants could communicate directly with me. Sorry. I've just since changed that. So I think we have one person that introduced himself. If you will go ahead and kind of copy and paste that or type that out again so that I can make sure that I mention you later. Again, welcome to today's presentation. We're going to be talking all things community health workers. So you are in the right place if you are interested in becoming a community health worker, or you are interested in becoming a community health worker instructor. And I hate that I did not disable that, that down bell for people coming in, but that's okay. Hopefully it doesn't bother or affect people too much. Let me make sure my phone is on silent. Again, I know that time is a precious commodity. So again, I thank you for spending your time here with me on Saturday. Please let me know if you can't hear me or if you can't see me. I think everybody can see me. I think everybody can hear me. Okay, it still said everyone. Okay, there we go, perfect. All righty, so before we get started here today, I want you to do me a favor. I want you to snap a selfie of yourself sitting here participating in this info session, or I want you to snap a picture of your screen. And the reason I want you to snap that picture is because I want you, if you want to get a surprise at the end of this presentation, to post and tag at Umemba Health with the hashtag CHW Info Session. So go ahead anytime during the presentation today, snap that selfie, snap a picture of the screen, go ahead and post that on any of your social media channels, because if you're on the social media channel, chances are we're on the social media channel as well. And if you want to save that picture and wait until you hear what the surprise is, you're welcome to do so, but don't forget to snap that picture sometime during this presentation today. I added a lot more information to this last night. I went through this presentation this morning. I'll try my best to keep this to an hour, but that is just me talking. Normally, I like to do an interactive, something popped up on my computer here. Normally, I like to do an interactive presentation. This is going to be more of a webinar than a workshop. Let me just tell you that now. And so you're here for information. Hopefully you have questions. I certainly have answers, but guess what? That means I'm going to be doing a lot of talking. I'm still going to provide an opportunity to answer all of your questions. We're going to have an open floor section of the presentation at the end. If you want to come off your camera, great. If not, you can ask me through chat, or you can leave your camera off and just unmute yourself. But I am going to talk a lot more than I like to, because I want to make sure you get the information. Again, I'm going to answer every question you probably need to know about getting trained to be a CHW or CHW instructor. In the event that you stump me, which I'm always looking for people to stump me, let me tell you, for those of you that don't know me, I do have a degree in Google University and a degree at YouTube Community College. So whatever I don't know, we will certainly find out before we leave the info session today. So heads up, so you know your time commitment. I'm going to talk for about 50 to 60 solid minutes, but then I've got about 30 minutes that I'm going to leave open where we can just dialogue, get to know each other, and you can ask questions and I can answer those questions for you. So I said I was not going to see who I was on here. I was going to hide faces, but I'm going to look really quickly. Okay, great, just to see who's joined so far. So the way that we're going to start off today, I'm going to tell you about my organization, Umemba Health LLC. I'm going to tell you about myself and some fun facts that maybe you do or don't know. We're going to talk about community health working. We're going to talk about what that training and certification looks like. I'll tell you about some upcoming learning opportunities with my organization and with other organizations as well. And then we're going to have that open floor Q&A time. So I have uploaded some resources available for you. One is the kind of the outline, not necessarily an outline, but resources to any link that I'm going to be talking about in the presentation, as well as a CHW career plan and competency handout. So please make sure you get that, that I uploaded into the chat. The other are really more specific to you if you live in Texas. So I do realize that I'm in Texas. A lot of my students are in Texas. So if you are in Texas and you're looking for a distance learning site or another program, I have provided that information for you that comes directly from the Department of State Health Services website. So let's go ahead and get started. So a little bit about Umemba Health. Umemba Health is a woman-owned and minority-owned boutique consulting agency. Boutique means small, and I am the woman and minority that owns it. I like to say that Umemba Health is a one-stop shop for community-driven approaches that improve the health of individuals and communities. And so one of the things that I did when I decided to start a business, first and foremost, you should know Umemba Health did not provide this type of training to community health workers and community health worker instructors. Initially, because I'm a certified diabetes educator, I started out providing virtual diabetes self-management, virtual diabetes prevention education to individual clients. So I had probably the first 6 months of business, about 5 clients. I did group classes. I did some free workshops over diabetes or blood pressure or kidney health. And I did that for about 6 months before the pandemic hit, before deciding to pivot like most organizations and companies have had to do so. But when I started my business, I really said, I've got to find something that really combines my passion as a nurse, and I'll tell you more about my background here in a little bit, but also my passion with public health. And so what we do is we work to improve both public health and population health practices. And we do this with individuals and organizations. With individuals, we support individual development, right? Continuing education, professional development, personal development. With organizations, we help to optimize their organizational performance. So we really want to drive healthy change within individuals, within communities, and within populations. So that's why we work with those organizations and entities. We provide public health education and consulting. We are committed to the professional development of the frontline workforce, and that's why you're here. We train community health workers, we train community health worker instructors, and we work with organizations that employ community health workers as well. So our mission at Umemba Health is to improve the health of individuals and communities through community-driven approaches. And our core values tie in directly to my personal core values. One of the things that I really want to be strategic about in 2021 is developing those partnerships and those collaborations that really tie into our vision and our mission. So one of our core values is a culture of collaboration. Secondly, I believe that excellence should be done in everything that you do. And I don't mean excellence as in perfection. And this has taken me years to learn. I mean excellence as in, I'm proud to say I created it. I was a part of it. It's got my signature to it or my stamp approval. And so we have a core value of excellence at Umemba Health as well. Any organization in 2021 should also be committed to diversity, equity, and inclusion. And I won't go any further into that, but that is also one of our core values. And because we believe that professional development, personal development, continuing education is so important, and that's the bread and butter of our services, we believe that one of our core values certainly has to be growth and improvement of individuals, of communities, of organizations, et cetera. So again, what we do, we provide public health education and consulting. And who do we serve? CHWs, CHW instructors. We have other clients that don't fall in that category. So we consider those either public health professionals or frontline health workers. And then for organizations, this looks like healthcare systems, community-based organizations, academia, and certainly other training programs as well. So for education, most of that is done through our Thinkific platform, Umemba Health Academy, which is our virtual school for CHWs and other frontline health workers. We feature blended training programs, and we like to say our training programs are interactive and engaging. Now, every once in a while, you've got to have a webinar, right? We've got to PowerPoint you to death, like I'm probably going to do today. There's a lot of information you've got to get, and there's not a lot of time. And we certainly have things like that as well. But for the most part, we really believe that in a virtual space, which is like why I prefer to call it a virtual school versus an online school, in a virtual space, you really need what's called virtual instructor-led training. That means there's a warm body on the other side of the screen that's going to be engaging and interactive, because this is what's really going to help you retain. You're going to be able to answer your questions in real time. This is going to help you achieve results that we say are easily replicated in the real world. Also, it's important to note that Umemba Health is currently a Texas Department of State Health Services approved provider of continuing education for both community health workers and community health worker instructors. As far as training goes, our training is mostly reserved for organizations and feature a combination of what you see on the screen here. This can be live and or pre-recorded webinars and live and or pre-recorded workshops. And while I'm here, let me just tell you the difference, because I told my son before I started, I've got a workshop, I'm probably gonna be available, 12:30 or 1, don't bother me. And he says, what's a workshop? Because he's only used to the term webinar. So I explained to him the difference. So a lot of times people are like, well, what's the difference between a workshop and a webinar? And again, this is gonna be more like a webinar today. But my preference is those virtual instructor-led training sessions and those interactive, engaging workshops. So it's similar to what you would do if you were working for an employer and there was a half-day training and a consultant came in and they had you doing all of these activities and different group exercises and things like that, well, you can still do that in a virtual setting. And so that's something that we offer to organizations as well. Virtual learning series are similar. They can be webinar-based or workshop-based. And it means we're going to take a deep dive on a particular subject, and maybe we cover that for a lunch and learn once a week or once a month. But we're going to take that particular topic and dissect it and provide a really in-depth training on that particular topic. And then virtual summits, not only do we have our own summit, the virtual CHW summit, but we help organizations by consulting with them on how to develop and implement their summit as well. I'll talk a little bit about the virtual CHW summit later, but I want to get through the bulk of the information here. And last but not least, we've got our consulting services as well. So you can find more information about the consulting services that we provide. We provide services in the clinical settings, the public health settings, and the educational settings. This year, we're really focusing on integrating CHWs. And so that's where we want to spend the bulk of our time with clients and with organizations consulting. So if you work for an organization or you know an organization that would like to implement CHWs, or they need to know the right way to implement CHWs, that's certainly something that we have expertise in doing. Now, lastly, we do provide mentorship and professional development services. One of the things that we were doing before we developed the CHW Mentorship Network was doing a lot of coaching sessions, career sessions, resume reviews, cover letter reviews, and I have a colleague in Las Vegas, Nevada that was doing the same thing. So we just decided to combine forces, offer a 6-week CHW mentorship and professional development program where we actually address these things on a weekly basis. So it's a small group coaching. We meet once a week virtually from all over the US, and we talk about different topics every week, from developing your resume and cover letter, developing your pitch. We talk about how to conduct a virtual interview, which many are being done now, how to look for a job. We help them optimize their LinkedIn profile. We have a graduation ceremony virtually. We have a keynote speaker virtually. I mean, we really try to take everything that you would normally do in a professional development program or educational program and put it in the virtual space as well. So if you'd like to find out more about that, the website is chwmentornetwork.com, or you can go to umembahealth.com and find out more information there as well. So now you know a little bit or a lot about Umemba Health. Let me tell you who I am. I'm just going to peek here and see who all's on. Okay, great. We've got a lot more people that have come on. Welcome, everybody. My name is Quisha Umemba. And like I said, I am a registered nurse. I am a registered nurse in my heart, in my soul. I try to get away from it, and I cannot get away from it. I have an associate's degree in nursing. I have a bachelor's degree in nursing. And when I went for my master's, I said, Quisha, do you really need a third nursing degree? I am always a plan B, plan C, plan D person. And I thought, well, if something happens to my nursing license, the degree is really not any good without the license. So let me find A master's program that, you know, if something happened to my nursing license, I would still be able to put food on the table and afford my way of life. And so I decided that a degree in public health actually fit my personality and married perfectly with my nursing degree. So I have a master's in public health. I'm also what's called a certified diabetes care and education specialist. This term used to be called CDE, or certified diabetes educator. And that's another passion of mine as well. And I'm a certified community health worker instructor. I have a couple of other certifications as well. So I am a certified lifestyle coach, which means I'm certified to facilitate the National Diabetes Prevention Program, also known as a lifestyle change program. And I also have a certificate of health ministry from Wesley Theological Seminary. So if you know nothing else about me, you know that I love to learn. As a matter of fact, I consider myself a lifelong learner. Although I don't want to get any more degrees or any more certifications, I'm really fascinated by business, of course, starting my own. So I'm a learner of the world now. I'm trying to do a lot of free courses and, you know, small cost courses and YouTube videos and all of those things that I would recommend for anybody to do. I would certainly not say go into any debt or collect any more student loans, especially if you've been to college or have some years of experience like I do, but you don't have to ever stop learning. So I am the founder and CEO of Umemba Health LLC. We have a very small firm. I probably do 150% of things. I have a virtual assistant and I also have a project manager. We are expecting to expand in the next 30 to 60 days. I do have an announcement out for instructors in which I will be hiring 2, hopefully within the next 30 days. So that's a little bit about me with Umemba Health. A few months ago, I co-founded Diversity in Diabetes, which is a Texas nonprofit that seeks to bring awareness and advocate on healthcare disparities in people of color living with diabetes. And then again, I'm the co-founder of the CHW Mentorship Network. So I'll leave all of those, not the emails, I'll leave all of those websites with you before the presentation is over. I think I've got it on one of the slides. If you have any questions about like my background or anything else like that, don't hesitate to put it in the chat or you can send it to me directly. I really do like telling people kind of like my story and how I got involved in public health because I think that it helps you figure out, you know, the best way for you to consider. So I do believe that if we're going to be spending our time together, that you should get to know me a little bit. So I wanted to do this slide to just kind of have some fun facts about me. I'm going to get some water first. And welcome everybody that's joined. There are some documents that I've uploaded into the chat. Make sure that you download those for your reference. So fun fact number 1, 90% of my degrees were obtained online. So I got married at 19. I had my first son at 19. I have never experienced college without working full-time, being married, being a mom, and going to school. I've never had the traditional college experience that my younger siblings got to experience. So, you know, while I was getting those degrees and getting those certifications, there may have been 1 or 2 classes that, you know, I had to go on campus to go, but I did not get the traditional college experience. Do I feel like I missed out on something? Not really. But I do feel like the degrees and the experience that I got by going online still serve me just as well as traditional in-person programs, which is why I'm a big cheerleader for virtual learning. Another fun fact, I entered the Army Reserve at 17 years old. Yes, a lot of people find that hard to believe. I went in on what's called a split options program where your parents kind of signed you over to Uncle Sam and say it's okay for you to go. If you're interested in this or you want to share this information with someone, I mean, it's just random, but you go between your junior and your senior year. You complete your 10 weeks of boot camp if it's still 10 weeks. And then your senior year, you do your 1 weekend a month of reserve the entire senior year. I will say, even though I did not stay in the Army, it straightened me out because I just got in the car. I was 17. I thought I was grown. I was skipping school. And so I went to the Army during that break before senior year and came back really a lot more focused and a lot more serious about my future. So after that, I got a full ride scholarship to OCU that I turned down. And I turned it down because I was in love. didn't want to leave him. And the relationship was over like 6 months later, but I had already turned down a full ride scholarship to OCU. So fail, big fail, number one. I was All-American on my high school drill team. And I know you're probably like, why is she telling us this? But this is something I'm very proud of. My children laugh at me because I cannot do the dances of today. However, if they would have seen me 15 years ago, I was in there. Another fun fact, my oldest son just moved into his own apartment. And every time I say that, it is so surreal that I have a son that is legal, not grown. He's not an adult. He is legal according to the U.S. government. But no, seriously, I'm super excited about this just new era of his life. And I'm glad that he's out of my house. Fun fact, I have had 2 failed businesses before Umemba Health. And I put this fact in here because I think it's really important for me to be transparent, not just with you all, but I try to be transparent with people that I mentor with also, because it's important that you realize you're not always going to be successful. I think it's Denzel Washington that says fail early and fail often. And so I've had 2 failed businesses before. One was a solo practice, and actually one, I can't even say it was a fail. It was a partnership of 3 women, and I decided to pull out. And so not throwing any shade, but I'm still going to my business, and the other 2 are not. Take it as you want to. And then last but not least, I am a social introvert. If you don't know what that is, then Google it. I think that's one of the reasons why I am thriving in this virtual space, where I know it's been really hard for a lot of people to adjust to. But I am a social introvert. I can be a social butterfly, but I prefer being alone or with a really, really small circle. And honestly, when I have to be too social, it takes a lot out of me. Like, I will probably be exhausted for the rest of the day after today. All right, now you know a little bit more about me. I hope you found it at least interesting, if not funny or comical. If this was an interactive session, I will be asking you at this point to tell me about yourself, and we usually do a round robin if it's a small group, but we're going to just pile through this so that I can get all this information to you. But I do want you to use the chat for those of you who have not done so yet. Please tell us your name. Tell us where you are from. Go ahead and share one fun fact, like I have just shared several fun facts with you. And then also share what you hope to get out of this information session. Now, I promise you, before we end today, I will go back and read these responses and make sure that I answer every question. So if you haven't done that, you got 30 seconds to do that right now. Okay, don't be shy. Go ahead and put that information in there. Let's get started talking about what you came here to learn about. What is a community health worker? CHWs are frontline public health workers that are trusted members of the community with a unique understanding of the experiences, language, and culture of the people that they serve. Thank you, Cynthia. Let me close that. It distracts me to see that. So CHWs are a bridge. They bridge the gap between the community. So let's say the community's here in the center. You've got social service agencies on one side, right? This is WIC, your food bank, your church pantries. And then you've got healthcare systems, doctor's offices, FQHCs, CHCs on one side. So a person that's a CHW serves as a link or an intermediary between these agencies. They are representative of the community. Often they live in the community that they serve, or at least they can identify with the community that they serve. And then, like it says, they can usually speak the same language. They went through some of the same experiences. A lot of times what you'll see with a community health worker that's working in a particular program, say a woman is working in a domestic violence program, chances are she has either grown up witnessing domestic violence, had a close friend or relative that went through it, or went through something similar herself. CHWs have been around for a long time, since the 50s. But you'll often see them go by other names. Some of those names, and these are just a few titles that CHWs go by, include community health advisors, lay health workers. You'll also see community health representatives. You'll see that, I can't even think of a state right now, but there's a couple of states that use community health representatives. You will see promotores de salud, which is what is the Spanish term for community health worker. You'll see outreach educators, peer health promoters or peer health educators, as well as care navigators. So CHWs have a couple of superpowers, right? And this is nothing, this is not to take lightly. This is actually what helps the change and helps the community open up to you. And we know, especially when you're dealing with populations of color and some vulnerable.
Marvel, I gotta go.
Uh-oh.
What's Marvel?
Somebody sounds so cute. Can you mute, please? Thank you. So one of those superpowers is trust. CHWs use trust and the ability to establish a trusting relationship with the community. So they use this trusting relationship, right? I look like you. I can identify with you. I've been through the same experience, or I know someone close to me that's been through this experience. So I'm going to use this know, like, trust relationship that I have with you to really foster communication, to really foster understanding. I'm going to use that to help you build individual capacity and community capacity so that you can advocate for yourself as well. And so I always say that CHWs are uniquely positioned to address health issues because of this trusting relationship. Another superpower that CHWs have is they are experts at addressing social determinants of health. And so I know many of us are in public health in here, but for those that are not, when I say social determinants of health, I'm talking about those social drivers or social factors that influence or hinder healthcare. So case in point, a lot of times patients want to go see the doctor, right? But maybe they can't go see the doctor because they don't have insurance. And maybe they don't have insurance because they have a job, or maybe they have a job and they have insurance, but the copay to see a specialist is $70 and they're limited income right now. They don't have the money to pay that copay. So a CHW, especially in a clinical setting, which is why I advocate for them in every clinical setting, can be that person there that's addressing those type of issues. Sometimes patients need help with their utilities. Sometimes they need help with housing. If I had someone to help me pay my light bill, then I could afford that $70 I need to go see the doctor. Sometimes they need help with food insecurity. If there's a CHW in the clinic that can help them access those services out in the community, then they can show them, okay, this is a list of churches that have food pantries available to you, and these are the day of the week that you can access this. Or this is how, let me help you apply for WIC, let me help you apply for food stamps so that we can address that food insecurity. So social determinants can be anything from education. So maybe, a CHW is going to help someone find a class so someone that speaks Spanish can learn how to speak English. Maybe I'm going to help you access a specialist, a special provider in your area. Maybe I'm going to find a way to prevent you from going through social isolation. Maybe you just, you're older, you live alone, you have to quarantine now because you were exposed to COVID-19. So who's going to be that person in the clinic that's going to do that? Because the doctors don't have time, the nurses don't have time, the medical assistants have enough on their hand. You've got to have someone that is an expert at addressing those social determinants and helping patients navigate and access those services. So the most common responsibilities from my research of CHWs kind of fall under 4 groups. So I've listed them here. As a CHW, access. You're certainly going to help increase access to care to help prevent disparities or inequities in healthcare. As a CHW, you're going to be an advocate, right? You're going to speak up for individuals. You're going to speak up for communities that can't speak up for themselves, and you're going to help them. You're going to build that capacity until they can do that for themselves. As a CHW, you're going to be a navigator. You're going to teach and show people how to navigate through health and social services and refer them to those services as well. And as a CHW, you're going to be an educator, providing health education and helping people to manage their chronic conditions. Other CHW responsibilities include providing direct services, mainly in remote areas. You will see this a lot. Meeting basic needs, helping to build, like I said, that individual and community capacity, and providing informal counseling, social support, interpretation or translation services, etc. I mean, the list really does go on and on. So there are a lot of skills that are needed to be an effective CHW. You'll often hear these skills referred to as competencies. In Texas, there are 8 core competencies in which you have to be trained to be a CHW. So some of these skills include communication, interpersonal skills, service coordination, capacity building, advocacy, teaching, organizational skills, and then knowledge-based skills on specific health issues. Some other skills, and these are kind of a combination of competencies that I've gathered from other states, but these include outreach methods and strategies, individual and community assessment skills, cultural sensitivity and responsiveness skills. You definitely need that as a CHW. Public health concepts and approaches. This is one thing that I found a lot of CHWs don't understand. Public health concepts, the different levels of prevention, primary, secondary, tertiary, and I can go on and on different other types of public health concepts and approaches. Professional skills and ethical conduct, documentation skills, which is grouped under communication skills, but so often forgotten, especially if you work in a clinical setting where there's EMRs or there's other types of platforms. Now we have engagement software where, you know, you can actually talk to your patients and they can talk to you. So being able to document appropriately to the work setting is so important now for anybody that works in public health or healthcare, but certainly for CHWs. And then that community capacity building is certainly an additional skill that you will need to be well versed in to be effective. So CHWs are in high demand. They're in high demand, and this has been seen even more so since the increase of the onset rather of the COVID-19 pandemic. So why are they in high demand? Well, one, they have a multi-dimensional skill set, right? So all of those competencies, all of those skills that I just mentioned, that's one of the reasons they're in high demand. Now, there's an issue with role confusion, and there's an issue with a lot of organizations and providers that say, oh, the CHW can do it. It's not a catch-all role. And I spent a lot of time providing this kind of education organization. It's not a catch-all role. There's a clearly defined set of responsibilities that a community health worker has. But just imagine if you have at least one person with this type of skill set in your clinical setting, how much more different your clinic or your organization can run. CHWs, there's hundreds, thousands of research and literature that shows how CHWs improve health outcomes and how these outcomes are cost-effective interventions. However, because of the healthcare system, you know, we really don't take hold of those preventative measures like we should. And this is one of the reasons why CHWs have not really taken a hold in the healthcare system like they should be. CHWs are also in high demand because the skill set is completely different than other members of the care team. Again, they are really focused on the real issues that patients face that are often the barriers to care. So they are the experts when it comes to social determinants of health. They are the experts when it comes to community resources. They are the experts with connecting the dots between the two and getting the patients the help they need to address those barriers. So I just looked at this information last night because I wanted to make sure I have the latest stats when it came to the job outlook for CHWs. And so according to the US Bureau of Labor Statistics, there are approximately 58,950 currently employed community health workers in the United States. Now, somebody said, wow, keep in mind that, you know, they go by a whole range of things, right? So I actually wonder if there's more than that. And because they fall under other categories, maybe, you know, maybe I'm a CHW, but where I work, my title is actually health educator, you know, or maybe where I work, my title is actually care manager, but I'm a CHW. So I actually believe that there's way more than this, but this is the latest stats as of May 2019. The average hourly wage for a community health worker is $21.34, which equates to our average yearly wage of $43,000. On the low end, the 10th percentile or 10%, it's about $12.82. And on the high end, I was really surprised. Some CHWs out there are making $32.80 an hour. Now, I don't know where they are, but if you know them, I would like to know what they do, how long they've been doing it, and if they can come and teach for me. Because if you're making that kind of money, you've been around a while, or you're in management supervision or something like that. So there is a big wide range, but it's certainly, I will say, regardless of where you are, CHW needs to at least be making $15 an hour, which is, to me, I consider that a living wage. And I believe that with the skill set they possess, they should at least be making that. I had not heard of a community health worker until I moved to Texas about 6 years ago. And overseeing the diabetes program for the Houston Health Department, one of the first things I had to do was hire 2 community health workers. Had never heard the term before in my life. So I spent probably about 4 weeks researching articles, seeing what other states were doing. What were they getting paid? What was their scope of practice? And I will say, after managing and supervising community health workers, I started mine with $18 and they went up to $22. They're certainly worth it. So something else that was surprising to me, the states with the most CHWs, I would think, because Texas is a leader in the certification process and how we oversee from a state level how CHWs are governed, I would have thought that we would have led with the most states, but we are 5th highest. Surprisingly, New York and California are not really advanced as far as their certification standards. California, there's no centralized certification process, neither is New York. Not saying that there are not training programs. There are training programs, but there's nothing that says you have to do XYZ to be a CHW and you have to do XYZ to continue that certification. You'll see that in Massachusetts. Florida has one, and of course we have one here in Texas as well. So here's a map if you are more of a visual person. That came right off the website, US Bureau of Labor Statistics. The darker shades of green show where there's more CHWs. I'm not really sure what the white means. I really didn't look at the website that much. It was kind of late when I did this, but I would say there are probably CHWs in those states. They probably just go by another name. Okay, let's talk about the scope of practice, or the limitations rather for the scope of practice. So we've talked about how CHWs have a multi-dimensional skill set, and they do. However, not all duties are suitable for a community health worker. So first of all, giving medical advice, even when I have my CHW hat on and I'm a registered nurse, I don't give medical advice. That's not something that is in the scope of practice for a CHW. Completing or participating in clinical procedures, unless specifically trained to do, is not something that a CHW does. And when I say trained to do, I'm talking about things that you can train your grandmother to do, right? You can train your grandmother to check her blood sugar, do a finger stick blood sugar prick. So yes, it's okay to train a CHW to do that. You can train your grandmother to check her blood sugar using a manual blood pressure cuff. So yes, certainly CHWs can be trained to do that. Even though the image, as I'm talking and seeing this image behind the screen, shows someone taking their blood pressure using a BP cuff and stethoscope, that's not something that I would necessarily train a CHW to do, because as a nurse, and I started out as a medical assistant, there were weeks of doing this and practicing this on one another. And so I personally wouldn't feel comfortable training a CHW to do that. And actually, I wouldn't even want them to do this. They have a unique skill set, and I really want them to work within that unique skill set that they have. Something else that you can't do as a CHW, you can't analyze clinical data. So if you're working in a clinical setting, let's say someone came in for their A1C, which is a 3-month average of blood sugars, you can't get on the phone and say, yes, Mrs. Jones, your A1C was a 7.5. That's not something that is within the scope of practice for a CHW. You're not going to make clinical decisions regarding the patient's plan of care. You're not going to administer medications, not even vaccines, not even if you're trained to do that. You're not going to administer any kind of medication, wound care, Again, really no medical interventions aside from those two that I said are okay without being properly trained, and that's dependent on the organization that you work for. You're also not going to provide formal counseling or therapy. And so when I tell people you can do informal counseling, but not formal counseling, it's usually a little confusion there. So when I say informal counseling, I'm saying these are incidental conversations. These are impromptu. Maybe it's during an educational session. Maybe you're doing a diabetes self-management group. You can provide informal counseling that's really coded or comes across as health coaching or motivational interviewing. But formal counseling is when it's a defined ongoing timed session, and it's based on a relationship. There's usually a contract involved. If you had therapy before, you know what I'm talking about. So you're not going to do that at all. You're going to be more of a health coach and really helping them come to the conclusions themselves. Okay. A community health worker, the role really is going to be dependent on the organization and the position in which they're hired. So depending on if you're working for a community-based nonprofit, if you're working for a social service sector, maybe, like the WIC office or something, or if you're working for a healthcare, your skill set and the duties that you do at each one of those organizations is going to be completely different. So I just want to make sure that I do say that you may not necessarily work in all of those competencies or all of those areas that we talked about. Excuse me. Okay, so now let's talk about some specialty areas. I am personally a big proponent of specializing. This is also called community health worker models. But the reason that I'm a big proponent of specializing is because I decided to specialize as a nurse, right? First, I specialized as a geriatric nurse. So providing care for those that are older. I worked at the VA hospital for almost 10 years, and that was my specialty. I was a geriatric nurse. And then I decided that I really liked working with patients that had diabetes. And then I went off to become a certified diabetes educator. There is a saying that says there's riches in the niches, right? And if you go see a provider, neurologist, urologist, nephrologist, it costs a lot more money to see that provider, that specialist, than it does to see your general practitioner. And so I'm a proponent of the specialty area because I think there's, I think I would rather have someone that's working with me that is an expert at one or two things and just kind of mediocre in a lot of areas. But let's talk about these 5 different models. I think I missed one. Nope. Okay. So the first one is the care coordinator navigator model. This is where you as a CHW you're gonna help patients that have complex health conditions navigate the healthcare system. And so I'll give an example when I talk about complex, because there are some complex patients out there. Let's say you have a patient that's dual eligible, right? Medicaid, Medicare, maybe they're 55 years old, certainly disabled, probably low income, maybe they're a person of color, if they live in a rural area. And you've got to work with this patient to help them apply for public assistance, access resources that are within, maybe a 5 or 10 mile radius of their house. There's so many things that are involved with this person's care. If they live alone and they don't have transportation, you've got to set up Meals on Wheels to come out or some kind of other process. So as a care navigator or care manager, you'll see that a lot, or service coordinator, this is the type of patient and the type of duties you'll do under this model. The next model is the health educator model. This is the type of model that I'm accustomed to as a manager and as a CHW supervisor. This is where you as a community health worker will deliver health promotion and disease management education to a target population. Next is the outreach and enrollment model. This is where you as a CHW will work in areas where services are primarily conducted in home visits. And I should have just said home visits here. You could also work for an organization that needs to enroll X amount of people per month or per year. So you'll see this with a lot of maybe grant funded programs. Maybe you work for the health department. They've got what's called CDBG grants, community block development grants, I think it's what it's called. And so one of the things you'll do is we got to sign up 100 people a month. Well, part of your responsibility is to go out, go to health fairs, man tables, go to these different community events, set up your area and collect these signatures or enroll people into whatever the program is. Community organizer is similar. Community organizers promote community action to build community support for new activities. So if you are a true boots on the ground person, if you, let's say, you volunteered to help people sign up to be voters, right? You did voter registration. Then if that is the type of person you are, then you would love doing this type of work, because CHWs that fall under this model do a lot of this type of work. And I do have a slide missing. I've probably moved it around somewhere, but the fifth model is care delivery team member, which is, again, my specialty. This is a community health worker that's working in the clinical setting, that's working in the hospital. You work right alongside the MAs and the doctors and the nurses to provide care to a population of patients. And we'll probably see it somewhere later, or I deleted it by accident. Regardless of what model that you work on, again, depending on the organization that employs you, you may do a combination of all. So my CHWs actually did a combination of all. So, they would go to health fairs, they would enroll X amount of people in our diabetes program per month. They were the educators as well. They did it all. So depending on where you work, you may do one or you may do all of these, work under all of these different models. So let's talk about some CHW trends and what you should see coming up this year, especially under new administration. So with the onset of the coronavirus pandemic, we did see contact tracing become a major trend as far as employment goes for community health workers. So if you don't know, contact tracing is part of the process of supporting patients and warning people that may have came in contact with positive COVID-19 patients that they were potentially exposed. And you do this in order to stop the chain of transmission. So I like to refer to contact tracing as detective work. If that's your personality, not my personality, but if that's your personality, you would probably love contact tracing. I've met people that hate contact tracing. I've met people that absolutely love contact tracing. It involves a lot of communication. There's a lot of case management. There's a lot of privacy and confidentiality as well, but that is certainly a trend. I don't see that going away for a long time. I will say that because there are so many people that are looking for jobs, and because public health, there are a lot of people that work in public health. There are some really big positions and big titles like epidemiologists, policy people that would normally work in other areas of public health that are just looking for a job that are taking these as well. But certainly there are a lot of CHW positions for contact tracers as well. Virtual case management is another trend. I foresaw this even before COVID because I saw when I was providing my virtual education to patients, like you could do everything virtually. I was showing people like how to do insulin injections, how to prick their finger, anything can be done virtually. So I'm not surprised that now you will see positions hiring for CHWs for virtual case management. A good colleague of mine, Claudia, works for an organization called Oscar Health, where they provide virtual case management. You're also going to see more CHW programs that specialize. And so when I say specialize, I mean it's a CHW program. You get certified to be a CHW, but they also specialize in sickle cell disease, or they also specialize in heart disease or diabetes. That's actually what we're going to do here at Umemba Health with our programs. Our CHW program has a clinical integration specialty or emphasis. Our instructor program has a virtual instructor training emphasis. And then also you're seeing other disciplines that are training as CHWs. And I've got a couple of slides to give you an example of what that looks like. But I want to tell you also, there is a link to the Biden plan for mobilizing American talent and heart to create a 21st century caregiving and education workforce. Joe Biden, President-elect Joe Biden, said before he even became president that one of the things that he was going to do to mobilize kind of caregiving and education in the United States is hire 150,000 community health workers. And so I think this was like 6 months ago he announced this. Now that he's certainly going to be president, there's a lot of buzz around this, especially if you're in, the line of work that I'm in. So just be, have this in the back of your head that there's going to be a lot more opportunities that are going to come. Some of this is going to come by way of financing through Medicare. Some of this is going to come by way of grants, kind of opposed to, the grant funding ends and then usually the programs ends too. But that's something you may not have to worry about for 3, 4, 5 years, depending on how long you have the funding for. So new opportunities for CHWs are on the horizon, and you can read that at your leisure. So when I talked about these other disciplines training, one thing that I'm seeing, I have a lot of students that are medical assistants, is you're seeing now organizations are wanting a combination. They want an MA, CHW, LPN, CHW, because finally organizations are understanding that until we address the social determinants of health in our populations, like we're really not going to be able to do much for them as far as healthcare. So what you're starting to see are programs and healthcare organizations that are starting to train their incumbent or their new medical assistants to enhance their skills and allow them to serve in these expanded roles. And so some of the expanded roles that I have seen in my research, I've seen medical assistants as medical interpreters. I've seen them as patient navigators. I've seen them as care and case management or coordinators. Of course, doing health coaching, that should say health coaching as opposed to motivational interviewing, but definitely I just saw this maybe a couple of months, 3 months ago, I think, was the first time where I actually saw a community health worker and then MA or LPN in parentheses. So be aware of that. I mean, there may be some competition coming, right? I mean, look at me. I'm an RN, but I also have a CHW as well. You also see pharmacy techs and CHWs, which is something that kind of blew my mind. But when I went to go work for Department of State Health Services, it makes a lot of sense to put community health workers in these community-based pharmacies. And so some of the things that they're doing to expand the role of a certified pharmacy tech, they're teaching them how to be community health workers or certifying them as CHWs so that they can help get those medication histories, so they can help assist in medication reconciliation, so they can identify potential drug therapy problems, so that they can reinforce medication education or medication adherence education. They're basically like the right hand man and woman for the pharmacist. So be on the lookout for that new trend as well. And then lastly, community paramedicine, which may or may not be a new term for you. It is an evolving field where you see paramedics that are being used in trying to divert emergency calls or 911 calls. And so you see this more in rural areas than you do in urban areas, because there's a tendency in rural America to use the ER as your primary care doctor. So in order to help reduce emergency room visits, in order to fill those gaps in healthcare delivery, to reduce the burden that you see not only to ERs, but also to primary care physicians, they're training community health workers in CHW concepts or as CHWs as well to help them navigate those resources, to improve their access. So maybe, someone calls about something and it's really not an emergency. They can give them a handout that says, you know what, you can follow up with this clinic, or these resources are available to you if you need help getting your diabetes supplies or whatever it is. Because let's be honest, a lot of people use the ER as the doctor. They're called high utilizers or super users, what have you. But I think this is genius. And there's actually quite a bit of literature out there right now that shows how this has been effective in some rural areas. Oh man, I'm almost at my time. CHW Training and Certification. I'm just gonna go. I think I may go over that 60 minutes that I said, but I'm gonna go. And I'm sorry if I'm taking your time, but it'll be worth it, I promise you. So CHW Training and Certification, I usually will go state by state. And so I wanna show you a link really quick, because every state is not the same, right? I'm in Texas. I do speak a lot to Texas, but I have students that are outside of Texas as well. So just be aware that there are organizations that require certification. Like Texas, you have to have certification to work as a CHW here. There are some states that are working towards certification, and then there are some that you have to be certified. You don't have to be certified to work as a CHW, but you have to be certified to bill for your services. So I actually want to see if I can switch my screen here, because I have, this is a link also in your handout that you got. This website is called the National Academy for State Health Policy. But there is a wonderful model that I reference every week because my business is virtual and I have students throughout the US and some countries. But this is the state community health worker model. You can actually click on the state in which you live to get the information, or you can click here and under the different topics if you want to look at specific information. For instance, if you want to see if there's an organization and a work group for your state, and I'm going to pick on Georgia, because Georgia is way behind where they need to be. You can see here, Georgia has a CHW advisory board. It was established in May 2017 with the purpose of aligning efforts statewide to define, train, and certify CHWs and to provide recognition to this growing group of professionals. And if you click on that, it will actually take you to that board or that organization, association, network, or whatever. And so you see that this Georgia Advisory Board is actually being overseen by the Georgia Department of Health. And any information that you want to know about the advisory board, about the coalition, about where they are, you can find it here. So you can see that they had a webinar last year, a couple of webinars and some other things. There's an email contact. So if you want to contact the individuals within your state, you can find that information there. Going back to the map here, what else did I want to show? I wanted to show, oh, you know what? I talked about California earlier, so let me click on California. So if you click on the state, you can get an overview of all of those different topics just on the one screen, which is helpful and quick. You can see in the state of California, like I said earlier, there's no state approval process for training programs or curriculum. So if you live in California and you want to do exactly what I'm doing, nobody is stopping you from doing that. Have at it. You see certification is not required by the state. There is some legislation regarding CHWs there, and there's the section code that you can click on to find more information, although it's just a limited definition of what a community health worker is. There are some organizations and work groups that are in California. So you can click here and get more information about those, get the contact information, reach out and start making connections if you'd like to do that. It tells you about the roles in the state in this particular report, the job titles that vary by employer, and then the state agency that oversees. You'll see a lot of these are overseen by the Health and Human Services or Department of State Health Services, similar to the way that it is here in Texas. So I'm not going to go any further into that right now, but when I open up the floor for questions, for those of you that stick with me, if you want me to look specifically at your state or answer any questions about your state, I'm more than welcome, more than able to do that. So let me go back to the presentation. I'm just going to quickly glance at the chat. Okay, great. And remove this out of the way. Awesome. So now that we talked about that quickly, because I know most of you are probably, well, I won't say most of you. I know there's quite a few of you here in Texas where I am. So let me quickly talk about Texas. There's no educational requirement in Texas. In some states, you have to have a high school diploma or a GED. That is not the case here in Texas. In fact, you can be 16 years old and get your CHW certification in the state of Texas. If you want to apply initially, you just have to be a Texas resident, which means 1 year of residing in the state of Texas, be 16 years old, and complete a DSHS approved CHW program like Umemba Health, or complete 1,000 hours of experience that's verifiable by your supervisor, and that 1,000 hours has to be within 3 years. The same exact thing to be a CHW instructor. You have to be a Texas resident, at least 16 years of age, and either completed the DSHS approved program or 1,000 hours experience in training individuals who provide CHW type of work in 3 years. So that's how I applied. I did not go through a program. I have well over 1,000 hours in training individuals who provide CHW related services, and my supervisor at the time verified that, and that's how I was able to become a CHW instructor. As far as renewing, some states there are no renewals. You become a CHW and you just exist. I personally do not think that's good for any professional discipline, because we should continue to grow and improve and stay up to date on our craft, because it serves us and it serves those that we serve. But in the state of Texas, you have to renew every 2 years for your CHW and your CHW instructor. Again, you have to reside in Texas and you have to get 20 hours of CEUs. Of those 20 hours, 10 of them can be what's called DSHS certified, which means you go to an approved training site like Umemba Health, you participate in continuing education, and that satisfied your need for the 10 hours of DSHS certified CEUs. The other 10 hours are non-DSHS certified, meaning you can go to Jim Bob's social service worker retreat, and it does not have to be approved by DSHS, but it does have to fall under the scope in which you practice as a CHW, and you can count those when you go to do your biannual renewal. The cost in Texas to apply is, at this time, free $99. There is absolutely no cost to become certified as a CHW or CHW instructor in the state of Texas. There is also, for those of you that have an entrepreneurial spirit like myself, no cost for you to become a CHW approved program or CHW instructor approved program in the state of Texas as well. So if you're here and this is what you're interested in doing, wink, wink, just giving you that little bit. So here's some things to consider, okay? When you're, because I know you're here because you want to be a CHW or CHW instructor. Not all CHW programs are the same. I've heard this time and time again from numerous students, and I'm not just talking about in Texas, I'm talking about all over. We've got a lot of CHW programs, especially some that were here in Texas, that were not able or have had a hard time transitioning their programs from in-person to virtual, because a lot of CHW programs didn't do anything on the computer anyway. So just keep in mind that because CHW profession, the CHW profession, is not regulated like the nursing profession or the social work profession or medical assisting, there's no set level of established standards. And there's some controversy around that, right? Because there needs to be, especially if we're going to make this billable and sustainable, but that's a whole nother conversation. But keep in mind, not all programs are the same. So definitely do your research. If you can, talk to someone that's been through there before. One of the biggest things on a survey that was done here in the state of Texas that employers indicated was the quality of CHWs are not always the same, depending on the program that you get them from. Organizations also don't always know how to utilize the CHW skill set. I get this all the time. This is one of the reasons why I say, you know what, we're going to actually start consulting with organizations on how to utilize the skill set. Again, there's role confusion. Sometimes there's a lot of animosity. Social workers think that the CHW is stepping on their toes, and vice versa. Sometimes it's like the CHW is just a catch-all person. Our medical assistant is busy and can't room the patients. Okay, Joyce is a CHW. Let's let her room the patients and she can get the histories. Now, keep in mind, Joyce was hired because she's supposed to be a care manager and she's supposed to be helping people access resources and keeping up with the resource guide and all of this other stuff. So there's a lot that goes into it. And I get CHWs that are always like, okay, Quisha, what do I do? They just got me sitting here scheduling appointments. I'm so much more than this. It's frustrating, and definitely if you work for an organization like that, you should tell them about Umemba Health. And then you want to decide if you should generalize or specialize. Again, I'm a big proponent of specialization. Of course, Once you first get trained, you may want to generalize and kind of get an experience with all of it. You can't figure out what you want to do if you don't at least get exposed to it or get some experience in doing it. Okay, so the last section we're going to talk about before I open up the floor is continuing education and professional, that's supposed to be development with 1 O, learning opportunities that are available for you. So continuing education, again, we offer that inside of Member Health Academy at different times. You'll see different programs available. I think I've got most of them hidden now. I like to offer them at certain times of the year, but you can certainly go there. Some of the programs are self-paced and on demand, meaning there is no live instruction. Some of them are blended, means there's a combination. You'll do some things self-paced, you'll do some things where you'll have an instructor on the other side of the screen. But you can find more information about all of our continuing education opportunities at umemberhealthacademy.com. So if you are CHW already and you're looking for CEUs, or you're just wondering if you'd like to get more information before you decide if you want to do that, then certainly start there. And then what I'm most excited about this year is we're actually implementing the certification program for CHWs and CHW instructors. And we will be implementing this in the next 30 to 60 days. So if you are wanting to get your name on the waiting list, then please go to the website, click on CHW or CHW instructor training and go ahead and sign up for the waiting list, because that's how I'm going to determine who fills up the seats first. I do want to keep, it's really recommended when you do any kind of virtual training, you keep the classes to 15 or less. I'm really maxing out each session, each cohort rather. They're going to be 4-month cohorts to 15 people. So if you're interested, go put your name on the waiting list so that you can join us when we launch, again, in 30 to 60 days. The only thing I have to do is select my instructors. So I told you I have the announcement of instructors going out, onboard them, train them to the curriculum, and we are ready to rock and roll. Again, we are going to be focusing on the clinical integration of CHW. So we want to train organizations on how to effectively utilize the multidimensional skill set that CHWs have. And so if you work for an organization or you know an organization that needs help, and it doesn't have to be a huge organization. If you got a family practice doctor that you know, or your family member has a small clinic, we work with those organizations. As a matter of fact, I would much rather work with an organization like that than a big, huge healthcare system, but I'm not going to turn anything down for sure. I want to give you a couple of other announcements. The virtual CHW Summit is coming up April 6th through the 9th. If you are a CHW, considering being a CHW, a manager or supervisor, employer of a CHW, or you oversee a network or an association, this is the place you want to be during our National Community Health Worker Week. We have a really stellar, dynamic lineup of speakers that are going to help you elevate your multidimensional skill set even more. Tickets, early bird tickets will go on sale February the 1st. And you can follow all of our social media pages to stay up to date on those announcements as well. Again, this is something that we also provide consulting for as well. So if you or someone you know would like to do a virtual summit, I say go for it. I really believe in virtual summits. They do a lot for your business. So if you are business-minded or business-savvy person, a virtual summit is the way to go to build your credibility. Again, I told you about the CHW Mentorship Network for Professional Developments. We are about to start another cohort. If you want to check out more information about that or apply to join the cohort, the website is chwmentornetwork.com. You can also get there by visiting umemberhealth.com. It's weekly small group coaching, resume, LinkedIn profile optimization, elevator pitch development, networking, I'm missing some, interviewing. It's everything you need. Whether you are a new career professional or you have been a professional at some time, go on the website, download the brochure, watch the information session, submit your application. $50 saves your spot. It is only $250 investment, which I know a lot of consultants and coaches actually charge more than that just to do a resume. So it's a program that we're really proud of. We launched it in November with a beta group, and they've seen success in job offers in their confidence in just networking and interacting and meeting people. So definitely check that out if that sounds like something you would be interested in participating in. Also, they don't pay me to say this, but I think this is one of the most probably resourceful resources for a community health worker. And this is the National Association of Community Health Workers, or NACHWA, I'm not sure how they say it, but it's $20 to join as a member, keeps you in the loop on everything that's going on as far as policies go, a really informative website. So go ahead and check out that website. Sign up to be a member. I have students that tell me all the time, I only signed up to be a member because you told me to, but it is so informative. They have like really good webinars and educational opportunities. So go and check that website out. That link is actually in your handout as well. Now my voice is cracking. So if you want to send me a direct email, you can do so at admin@umemberhealth.com. We are on social media, Facebook, Twitter, Instagram, and LinkedIn at Umember Health. Follow our YouTube channel. We've not been very active. That is something that I and my oncoming instructors are going to be more active about this year. So follow us at Member Health Academy on YouTube there. And then if you would like to go to the websites, that information is there. That last website is for the nonprofit Diversity in Diabetes. That should be .org at the end. So before I open up the floor, remember at the beginning I said I wanted you to snap a selfie or a picture of your screen, and I wanted you to hold it or post it. This is why. For everybody that's here today, I don't take it lightly that you came. I know your time is a precious commodity. I want you to post and tag your picture or your screen and tag us at Umember Health. Use the hashtag CHW Info Session. And once you do that, if you are interested in being a CHW instructor or a CHW and you join, you're going to get $100 off tuition. I don't know where the extra T came from. I guess because I was doing this at the last minute, but go ahead, take that picture. I'm going to pop up a couple more slides here so you still have an opportunity to do so, but you will be able to get $100 off tuition for the CHW program as well as the CHW instructor program. So again, here's your opportunity. Go ahead and take that selfie or take that picture. And I want to thank you all for attending. At this time, I am actually going to open up the floor for questions. So let me pop this up where I can see everybody's face. And if y'all will just excuse me for 1 second, I'm going to stand up and turn my fan on. It's hot in here. Okay, let's open up the chat. 12:14, I didn't do too bad. All right, hello Miriam from Dallas, Texas. You're interested in being a CHW after you graduate. Well, congratulations for being so close. And it was my honor to host the website. I hope you found it informative. Hi, Cynthia. I think you're actually one of my student learners in Umember Health Academy. Good to have you here today. Hanaya from Cyprus. It's so good to have you. Bachelor's in Health. Great. Hope this information was helpful. Leonora, good to have you. One of my dynamic speakers for the summit. I hope to learn how CHWs can serve in research spaces. Wow, that's a great question. Let's see, Wendy from Brooklyn completed her associate degree in community health education, currently doing her bachelor's in community health education, minor in public health, interested in becoming a CHW. I love that. I love that. Welcome, Wendy. And Sophia Jones from Houston, interested in becoming a CHW to broaden exposure to public health. Awesome. Thank you all for coming today. Does nobody have any questions? You can go ahead if you want to and come off of mute. You can show your face if you like, but I mean, I'm gonna stop the video that I'm recording of myself and I'm gonna be here. I am committed to being here to 12:30. So I wanna answer any questions that you all have.